guys, to episode 2 of Tooth Be Told. If you haven't been with us before, this podcast is all about helping our people of color in regards to dental care. I'm Erica.
Good morning, everyone. I'm Brandy.
So, on today's episode, we're going to discuss dental complications. Okay. Dental complications can be terrible. They could have come about because maybe you do go to the dentist and then you didn't listen to your doctor and come back and finish something, because that actually happened to me before. But Brandy, can you give us some examples of things that can happen in regards to dental complications?
So a lot of dental complications come about because patients are not always like forthcoming with, all the medication they are taking at the current time, or any surgeries they've had, or procedures, any hospitalizations. So just not, making us aware of all the things that are going on health wise. I think a lot of people believe that their health and their dental health are two different things, and there's no need for me to know that they have glaucoma and that they're taking eye drops for them, or that they had a knee replacement. And those things are really, really, really important, especially dentally, because there can be some contraindications um, when it comes to dental care and some of those things. So that's how a lot of those things come about, just patients not being forthcoming and not giving a full um, medical history. Sometimes also patients are not forthcoming purposely. They are just poor historians. They don't remember, they're not sure, they don't know what their medications are, they're not, certain that they had a certain procedure, especially when folks get up in age. So it's really important to have that information. It is like
When you said about the knee, though, I'm honestly, I wouldn't even have thought about that. Like, I figure medications, of course. And this is kind of like us piggybacking on our very first episode. We did go into this a little bit
yeah.
about people not knowing their medications and things like that. And this could be a hazard, right? Obviously. But I would have never thought that. Is there like, I know sometimes like when I go to the doctors, they'll be like, do you have this inside your body, or do you have that? I guess, is that in lines with that?
Yes. So I think sometimes when you go to the doctor, they need to know that those things for, if you're having certain testing done, or
Mhm.
whatever the case might be, because that can interfere with the testing. But as far as dental is concerned, we need to know, because whatever treatment you have, whether it's a cleaning or a filling, an extraction, a crown, a bridge, whatever the case
Mhm.
might be, a lot of bacteria is released into the bloodstream when you do those things. And that bacteria usually goes directly to anywhere where you've had any implantation device, whether it's a stent or a mesh placement. If you had a knee or hip replacement, if you had some kind of metal pins, rods, or stents inside of your body, it can cause a really life-threatening infection. So a lot of patients who have those things done, they need to take a antibiotic pre-medication prior to any dental treatment. If they don't know whether they have to do it or not, we have to seek a medical clearance from their orthopedic doctor, their heart surgeon, their cardiologist, or whoever is in charge of their health care from that standpoint. So if we
Okay.
don't have that, we really can't move forward.
Now, please tell me, please do tell us, what things have you seen when this does not take place and people are not up front with you or forthcoming?
I've seen so many things go on. Mainly just, patients being mad that I'm like, you have to have this and it's for your benefit.
No,
And I
I
don't care.
mean, like, and I don't mean to interrupt you, but I mean, like, has anything like medically happened, like something like,
Oh, you mean like an adverse reaction or
yeah,
something?
yeah, like that. Like, I don't want
To
to.
me, no, because I play zero games. So
Okay.
no, I'm like on top of it like Rose. Okay. Like on
Right on top of that, Rose.
exactly. So I don't play a game. But I mean, I have seen things happen. I've heard um many stories about things, and I've seen happen to other practitioners, like other doctors and stuff like that. So,
Well,
you
what
know,
happened? Tell us. Do
well,
tell. What had
I mean,
happened?
people have to be rushed to the hospital. Their
Mm,
blood pressure spikes. Some people have had serious infections in those areas, and then after having a cleaning or after having some dental work, and they call back to the dentist like, I have this really horrible infection, and my orthopedic doctor wanted to know if I had dental treatment recently, and I did, and it's your fault. And then when you go back to their chart, they have nothing listed. There's nothing listed. They did never. Have you ever had any surgeries? No. Everything's checked off. No. So you can't, that practitioner can't be held liable, of course, but the
mhm.
practitioner also could have failed in getting a thorough medical history. So it's on both the patient and the practitioner. So whether that's the dentist, the hygienist, the specialist, whoever they're seeing, they need to be on top of it. And remember, I said before, be like Columbo, ask them questions 10 million different ways. I do it all the time, and I get a different answer every time I ask a question. So it's important because yes, you can have a life threatening infection if you do not follow certain precautions prior to dental treatment.
Yeah. Listen, y'all, you can die. And you'll be like, oh, they died because of
Listen,
what? How they die?
and it sounds
Because
crazy.
they didn't do what they were supposed to do, And
Yeah, like
it's
a
like, we don't
simple
want to be
thing.
like, you died because you didn't follow the directions at the dentist.
Exactly. So something simple as, you
That'd
know
be one
what?
of those ones that be like, undisclosed. They died for unknown reasons or something like that. When you be like, it's
Yes.
suspect.
And you
It's
know it's
suspect.
something suspect.
Right. Like,
Whenever you hear that, it's like, or yeah, or like somebody, the family, I guess, don't feel comfortable saying what
well,
really
because
happened.
most of the time it's because I mean, I'm going to just say it, probably on drugs, something like that.
It could be anything, or it could be something as simple as they didn't pre-medicate before
Right.
dental. You know what I'm saying? Like, that's crazy.
And I love your references to things that a lot of our viewers, hopefully, if they're our age or older, maybe a little bit younger, Columbo, right on top of that road.
Yeah, that's true because Columbo. Yeah, well, you want to Google it if
Because
you want
Columbo is back, way back. Like, they're going to be like, who's that? Who's Peter
on
Falk?
his way back. Yeah, Peter Falk. Just Google him and Google the
Just Google
show
him.
Columbo.
He was great.
He's a
He
detective, but he was on top of it. And
was.
that's
He'd be
how people.
like, with his eye,
Yeah, exactly.
with his trench coat.
With the seriousness. But yeah, that's
Yes.
how you got
Yeah.
to be. You
We
have to
digress.
be like a detective. Like,
Yeah.
I mean, I do. I see people around me all the time. And let me tell you, they don't ask no questions. They're like, oh, has your medical history changed? And the patient is like, no. Now, it's always no, because nobody really wants to talk about nothing. They want to get in the chair and get out. And I'm always like, okay, well, let me go over your medications real quick.
Hmm.
I'm going to read them off. And I'm like, are you still taking the, amoxicillin, the amlodipine, blah, 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 blah? And they're like, I'm still taking the same things. Yes, but I'm going to read the list off. I read the list off and they're like, oh, you know what? I don't take that anymore. Or they swap that out for something else. Oh, okay. Yeah, that's why I like to go over them one by one because, people don't want to, it's like to them, it feels like a waste of time.
It makes you wonder, like, if you're on all these medications, you're clearly going to other doctors. Other practitioners should be following these same practices. So it's like you're going to the doctor and they're not asking you. So it's like you're not aware that this is what's going to.
Well, you know what? No, I think other practitioners are asking. I just think people are aloof and they think somebody else should be responsible for it.
They
Like,
are.
seriously.
They are
Most
very
is like,
aloof.
it's not a big deal. So, yes, other practitioners do ask these questions. And you know what happens? They say the same thing they tell me on the first ask. It's, no, nothing's changed. No, it's, whatever the same. So, you got to dig a little bit deeper. That's all.
Yeah, just like I said before, for episode 1 about how I know my prescriptions. Thank God I'm not on many prescriptions, but if I have I have a pharmacy, I have the app on my phone, and that's a quick reference. If you don't know off the top of your head, but
Mm.
some people don't have that either, and then it
Yeah.
leads to dental complications.
Yeah, I mean, it's just important. You could always keep a list in your wallet. You can keep
Your
a
phone,
list of a picture on your phone if you don't have an app.
Right, especially if you're taking a lot of medications.
Write it down. I mean, I've had patients taking over 30, 40 medication,
What?
which
For
is
what?
anything you can imagine.
Oh my god.
Anything under the sun.
I could have that's like a whole I mean, how much time of the day? And God forbid if you go on vacation, you gotta bring all these medications.
Yeah,
That's
you
just
have
like
to.
and that's gotta be hard for the doctors, like, different interactions with all those medications. I would
Right,
hate
yeah, because you have to kind of make sure what you can give somebody and what you can't. So for instance, I'll give you a for instance. If I have any patients that have glaucoma, I always ask them, are they taking eye drops? And they're like, oh, what's that got to do with anything? And I'm like, well, some of the eye drop medications can cause a serious pressure inside the eye, and it interacts with some anesthesia that we give patients. So, an oral anesthesia, sometimes it can cause a pressure buildup in the eye that can lead to blindness. So I just want to know, because if I have to anesthetize a patient or numb a patient, I want to make sure that there's not going to be no issues later with someone's eyesight. And that's something you wouldn't put together. You wouldn't put those two together. You would never think that. Um, so it's important to know, or, some medications interact with others in different ways, and you might have to, use something different, or a patient could be allergic to something. I had someone yesterday who, she had listed zero drug allergies on her thing. So I went over her stuff and I was like, I see you have a food allergy. Do you have any drug allergies? And she's like, no, I don't have any drug allergies. And then, like, I'm getting her stuff together and she's like, oh, you know what? I do have a drug allergy to erythromycin. Okay, that's a big deal. Like, what do you mean, no, you don't have none? And it's never been in her chart. She's been a patient for like 5 years. And I've
what's
never
up.
seen her. It was my first time seeing her. Like, she had always seen the other hygienist. So
Mhm.
that means the other hygienist suspected deck. She ain't asking nothing. Okay.
Shady. Shady.
They steady working on her.
Yes, and then can't
Steady.
that be like can't that'll come back on you
Well,
and
the thing is, she didn't disclose it, the patient.
that's
So
true.
it's her fault. I mean, but
This is
we
not in your
still need to
chart.
know. You know what I mean? Like, I still need to know.
Now, what
So
is that medication or whatever you said she was
it's
allergic
a
to?
antibiotic.
Oh,
And
okay.
so it's related to like clindamycin or cleocin, or which is a common antibiotic that we give out
Okay.
dentally, because a lot of patients are allergic to penicillin or amoxicillin, and that's like the next kind of go-to if you're allergic to those things. um but you need to know that. I don't know. But point being is that folk need to be on top of their game when it comes to
Mhm.
knowing what you've had done, and what surgeries you have done,
Yeah.
or just your history in general. Like, even if it seems minuscule, or like, your dental practitioner doesn't need to know, they need to know, just for GP, just so, like, if anything happens, we have a medical history. If God forbid something happens while you're in the chair, we're able to treat you and not use certain things that are going to make the situation worse. So
Yeah, because it'll be less trouble for everybody if people would just pay attention. But you said people don't listen.
yeah,
You
that's
can
it.
lead a horse to the water.
Yeah, listen,
Okay.
can't make them do nothing else.
Right.
Can bring them there all
Because I
day.
oh, no more problems.
No, absolutely not. So there's other things that I want, because I have wrote down a couple of things. There's a lot of people who have heart disease, congestive heart failure, people who have had stents placed, have had open heart surgery, valve
Pacemakers.
replacements, pacemakers. All of those things, you need to have a clearance from your cardiologist to have any dental treatment, especially if it's done within the first 6 months to a year. I won't do a cleaning on anybody, especially if they're a new patient, and they come in and say, "Oh, I've had a stent, or I have a pacemaker. Um, I've had open heart surgery. I had a heart attack." Anybody who's had a heart attack within 6 months, I'm not seeing. Like, I need a clearance.
Hmm.
Um, The pacemaker is important because if you have a pacemaker, there's certain instruments and things that we use in the office that can interfere with the um, wavelengths of a pacemaker. So I'm not able to use certain instruments. So I need to know that. Um, and also, like, we can't use some of our machines in the back in sterilization when somebody comes in with a pacemaker because they're ultrasonically powered and it can interfere with the pacemaker and how it works.
This is so
So
interesting. I wouldn't. I mean, obviously you've trained and you have plenty of years of experience, but do you learn all this in school, or is this just as time goes by as you're working? Like,
a lot of like the basic stuff we learn in school, like the big stuff, like people who need to pre-med and we learn about, medication, we learn all of this stuff, but a lot of it, you do see because school was really like intense. It was insane.
I'm sure it was.
So I mean, you learn all that stuff, but it's not until you practice every day where you're like, you can actually see
Yeah.
it in real world time. And you're like, okay, so then you're like, all right, that's that. And I know next time, that won't happen or that won't be an issue. So you live
Right.
and you learn.
Mm-hmm.
Um,
Because practice
but
makes
yeah, and I was
perfect.
trying to think of something else
I.
that people might. Oh, okay. So we talked about the joint replacements. If you ever had a
Mhm.
knee, hip, replacement or any kind of metal pins placed inside your
Mhm.
body, you have to have a clearance from either your orthopedic doctor or whatever specialist placed it. Um, yeah, so that's really important, like we said, because of the infections.
What about if you're like on blood pressure pills?
Blood pressure pills are okay, more like blood thinners. So if you're on a
Mhm.
blood thinner, a lot of people take like a daily baby aspirin every day,
Mhm.
which typically is okay. Usually it has to be a higher dosage. That's like 81 milligrams. So usually it has to be like 325 or above. But
Mhm.
the one thing I want to tell people, Erica, is that please, I can't stand when people come in and they like, oh, I stopped taking my blood thinner because I knew I was getting a cleaning. Mm-mm. No, you don't do that. I don't need you to do anything for me, like, because you need to
No.
make sure you straight. Like, the only way somebody should come off medication is if their doctor is like, you know what? Yes, and it has to be in writing somewhere where I can put it. Like, you need to stop your blood thinner 7 days before this or 3 days before that. You can't just be doing, oh, I didn't do that, or I took this before. Like, just doing their
Yeah.
own thing, literally making stuff up. Oh, well, why did you do that? Oh, I just thought that because, my girlfriend, when she had hers out, that's what she said she did. We
No.
need to be better, y'all.
It's so
Like,
funny because
seriously.
I get laser hair removal. And there's certain things you can't do before you get laser hair removal. You can't tan or, for a certain period of time. Or I think it was I couldn't take iron pills. Or one time I went and I couldn't get it done because I had taken an iron pill. I believe it was iron. It had to be iron. But yeah, and it's a good thing I know that I'm taking these things. At the time, I forgot that I couldn't take them because I'm doing my due diligence and was like, I gotta take my iron pill.
Right.
And then I forgot about the fact that I wasn't going to be able to do that. But thank God, because that could have had an adverse reaction. Skin could have broke out or whatever, something kind of discoloration. All kinds of things could have happened.
Yeah.
Not with my face.
Yes.
No.
Listen, not with your face, not with your body. So
No.
it's like simple, simple things. I think that, oh, there was another thing I want to talk about. So
Okay.
also patients who come in who have osteoporosis, there are a lot of medications. They're called bisphosphonates, and typically, most of these patients, ladies, is mostly women who take these medication.
Hmm.
I rarely see
Hmm.
men who take them. And really, it's mostly white or Asian women that take them. But I do have some black women. Usually, they're a little bit older, and they're petite, like
I was
very
just about to say,
small.
because my mom's petite and I believe she takes that.
So there's different kinds, but what I was saying was usually there's like an injection. If you take an injection, sometimes it can be yearly, sometimes it can be quarterly. But if
Hmm.
you ever have any dental issues where you need to have, if you're going to have an implant placed or you're going to have a tooth extracted, it is super important that your dentist knows you're on that, because it works, it's supposed to strengthen your bones like throughout your body, so that
Hmm.
you don't have any fractures as you get older.
The
Your
calcium.
bones are not brittle, they're not weak. Yeah, and then they usually take calcium, which the calcium is fine. Or vitamin D, that's also fine. But
Hmm.
this particular class of drugs, it works differently in the jaw. So although it strengthens bones throughout the body, the jaw works differently. So the jaw replaces cells at a very rapid rate. So when you remove a tooth, when somebody's on this kind of medication, it can cause, there's no blood supply. So, meaning there's not a lot of blood flow in the area. And when there's no blood flow, you can have a portion of your jaw necrose or die, because the blood has to flow in order for it to heal.
Girl.
And this
Child.
drug causes
Mm-mm.
that issue. So, a lot of
Mm-mm.
times when I used to work for the oral surgeon in Cherry Hill, he would have them do a blood test. It was called a CTX. And you would get the CTX before, and it would tell you the concentration of this drug in your body. Once it's
Hmm.
at a certain concentration, he felt safe to remove teeth. If it was above, you can't have the teeth removed. You have to wait it out. Or a lot of patients would want to wait. They would go to other doctors who were not as informed, and then come back to us when they had an issue with healing. So
Mm.
it's really, really important. So a lot of times patients will have to come off of that drug for a certain period of time, for it to get to levels where it's safe to remove your tooth or to place an implant, because the healing is really poor when you're on that. So for folks who know somebody who has osteoporosis and taking that drug, it's really important, the dental implications with that.
Wow, there's so many complications. I mean, you can go on and on and
I
on
can
and
go on and
on.
on, but you
Yeah.
guys can always, if you have a question about a certain drug you're on or a procedure you had done, you can always email us at toothbetoldpodcast@gmail.com. And I will do my very best to get information to you, email you back about that, because I could go on and on. But those are some of the bigger ones that I was thinking. A lot of people, it's pretty common for people to be on those drugs. It's pretty common for people to have, joint replacements. That's very common. Um, and those kind of things, or to have, heart disease or having stents placed.
Yeah.
Also, if you're a former cancer patient and you have a port, you also have to have, because some patients keep their ports even though they're not on chemo anymore, because they're getting other kinds of infusions.
That was my next
So
question. Like, why? Why?
yeah, and then
Okay.
I actually have a patient who is not getting any infusions, and she still got her port in. She's like, "Oh, I just never had it removed," and I was like, "Okay, well, you need a clearance, like, because you're going to have to pre-med." And she was like, "Well, why?" I'm like trying to explain it to her. So yeah, if you
Okay.
have something implanted, you
Hmm.
may also need to have a clearance too. Just one other thing I was thinking about.
Well, Brandy, you are a wealth of knowledge.
Well, thank you,
You are damn
girl.
good at what you do.
I
Okay.
listen. I take the
And I want
compliment. I
Yes, and
take
I
it.
commend you. And you know what? We were friends all this time, and we've never really gotten. Because I don't. I try not to ask you about your job, because sometimes when you off of work, and I'm like, I'm not the one to be asking my friend that's the doctor or the hygienist or the lawyer a bunch of questions that other people have to pay for. It's just not. It's just not good.
But it's all good. Like,
Yeah.
I have zero issues with answering questions or just trying to pass on. I'd rather everybody know. It bothers me that people come in and they don't know, these things, because we're not being taught. The knowledge is not being, patients get pushed around sometimes, and it's just like,
Yeah.
they get from one place to another, and they're in, they're out, and that's it. They don't understand. So I just want people to understand and know that, these things are really important.
They are, and what we're trying to do is help our people, because and definitely you're gonna be able to help others, but we really don't get enough. Like you said, we don't help each other, unfortunately. Overall, I'm not saying we don't, but because clearly we're doing that now, but
Not
we don't.
overwhelmingly, no.
Yeah,
Not overwhelmingly, but
we don't, and we really should be. We fought to be where we're at right now, so why not help each other?
absolutely. We need to
So
help each other. So the information
yeah.
is there. Also, you can visit the website at truthbetoldpodcast.com. So
Yes,
you
correct.
can find what's on there, Erica. What can they find?
They can ask a question. They can see about us,
Okay.
some background information on, the two of us. You can also
Yes.
see we're going to be uploading, the shows on that site as well. Um,
Yeah.
yeah. So
Yeah.
basically,
The
like
past episodes will be
yeah, the
on.
past episodes will be uploaded on there. Some pictures, things like that. We'll be actually expanding. You'll be seeing some like right now you have the pictures of you in work mode, with your garb on.
Well, garb on.
What is it
Don't get
exactly?
the garb on. That's exactly
Yes.
how I go to work every day. I don't want nothing on me in any way,
Yes.
shape, form, or fashion.
Yes. Absolutely. I know you don't because okay. I could
Exactly.
I'm not see I'm just here because like I said, this is our second episode, but I am a person who likes to go to the doctors. Not that I like to go to the doctors, but if something's wrong, I'm going to go to the doctors. I mean, and then that's one of the issues we have out here today where people just don't go to the doctors. So we're trying to encourage you to go to doctors overall. Of course, this is about dental. So that's the focus because Brandy's the expert on that. But, just taking
Yeah.
care of yourself in general. But
Yeah.
she's the
And
expert.
I'm sorry, Erica. Go
No, it's
ahead.
okay. Just talking about you being an expert.
Um, no, I was going to say too, in future episodes, I will break down also like different procedures so you guys know like what each procedure is like that if you're coming in for a root canal, if you're having an extraction, if you're having a denture made or partials. I will break down all of the visits and steps that you go through so you'll know what to expect when you go to the doctor as well. So that will be coming soon, but just to give you an idea of some of the things that will be in store in the
Yeah.
future.
Like next episode 3 is going to be about your overall health and wellness. So that piggybacks on what I was just saying about making sure you go to the PCP,
Yes,
because you
absolutely.
need to going there helps. And if you need emergency surgery on a tooth that you didn't take care of because you ain't been to the dentist in 20 years.
Yeah.
It
Get them,
happens.
Erica, get them.
It happens. Okay.
It
So yeah,
happens.
we got so many things. She's got so many stories. She has a list of content that you would never believe because it's 20 years of experience.
Listen, I'm always adding to the list,
Yes, I
and
do.
just I'm always adding like in that thing,
Yes, and I'd
and
be
I'm
like, what is that? What does that mean? Like, I was like, well, when we're on, we're gonna be able to, like, people gonna be like me, like a layman. Like, can you put it in layman's term? Because